this video, we'd like to continue on our PCOS series, and today we'd like to talk about how do we achieve effective treatment for PCOS so that we can achieve the goals of healthy pregnancy and avoiding any potential miscarriages, because that is our eventual goal for our patients. Not only do you need to get treated, you will need to achieve healthy full-term pregnancies and also have newborn babies as a result of the treatment. So as we all know, at Antai Hospital, with the decades of experience, we understand that PCOS, the root cause behind it is the presence of these specific tissues that secrete testosterone. And these tissues are abnormally present congenitally as well within the ovaries of our patients who then develop this PCOS because of the high testosterone levels. They develop several symptoms and also other complications which can cause different variations of PCOS. Clinically, talking about symptoms alone, PCOS has up to 28 individual symptoms. It's quite a complex condition and can be categorized into 4 broad groups. If you'd like to find out about what are the groups and the clinical symptoms, please visit our previous video, or you can see in the link here. So at Antai Hospital, how we treat PCOS at its root cause without using medication is via 3D laparoscopic surgery. Now this procedure is known as the destruction of ovarian Leydig cells. These are the tissues that are abnormally found within the ovaries, and destruction simply means that we need to use laparoscopy to pinpoint and physically remove these tissues so that we do not remove any ovaries or remove part of the ovaries. We simply remove these androgen secreting tissues that are found within the ovaries. As long as this is achieved, you will realize that the PCOS, the underlying symptoms, all of the complications will quickly go away, and you can see that your menses is regular and you can go on to achieve healthy pregnancy. But why do some women, even after going for this destruction of the ovarian Leydig cells procedure, why do they still do not see being able to conceive, or why do they still have miscarriages? It's because many of them, they have not had a comprehensive treatment. For example, let's say this patient has PCOS. Once we remove the Leydig cells, this patient is still having an insulin resistance. She's still fat because of the years of having no treatment, and the accumulation allowed her to become obese. No matter how hard she tries, she's unable to lose the weight. So for these types of patients, it's not that she's unable to lose the weight, it's because she has a congenital organic malformations. The organs of her body, specifically the stomach, it has an abnormal shape that allows her to accumulate more food, to take in more calories than her counterparts. This one, we need to not only remove the Leydig cells, we need to do surgery as well to adjust the stomach shape. So some other patients, for example, those that have not only PCOS and also have some form of uterine malformation, as we've said, organic malformations, whether it's the stomach, sometimes septate uterus, naive uterus, you should still need to go for hysteroscopic adjustment, hysteroscopic correction to correct the uterus shape. So effective treatment is very crucial to achieve the goals of pregnancy. Not only do we need to treat the PCOS, we need to treat any other underlying factors that are associated with the PCOS that can affect your pregnancy journey. Conventional treatment, although they are doing the right thing, which is they are doing laparoscopic surgery on the ovaries as well, but the methods, the goals are wrong, although the intentions are there. For example, they like to do ovarian puncture, ovarian piercing to remove these androgenic cells, but it's not that effective. And furthermore, they also like to prescribe medication, the most popular one being Diane-35, which is rather effective, seemingly, because it can bring down the high levels of testosterone. However, it can cause a dependence on this medication, and furthermore, prolonged use can affect the hormonal balance and also the behavioral and also the brain chemistry as well. So it is important that not only do we achieve effective treatment, we need to do it as early as possible. At Antai Hospital, we do urge and recommend our patients that you need to seek PCOS treatment as soon as you can, and don't wait until you are married and then you are experience infertility or recurrent miscarriage. Don't wait until then. Try to get it treated as soon as possible because success rates are incredibly high, and then you don't need to prolong yourself in these types of conditions where the PCOS can worsen, symptoms can worsen. In conclusion, Antai Hospital urges that not only do you need to treat the PCOS, you need to treat it effectively to achieve pregnancy goals. So do get full diagnosis whether or not there are certain underlying conditions associated with the PCOS. Not only do we need to remove the Leydig cells, we need to identify are there any presence of uterine malformations, chronic hormonal imbalance, and also stomach surgical correction. These are some of the factors that we need to look into, and rest assured a healthy pregnancy can be achieved. So if you'd like to find out more information or if you'd like to seek this treatment with Antai Hospital, please visit the website and also set up a consultation so that we can help you achieve your pregnancy goals today.